We've been hearing a lot about atrial fibrillation really because it is basically a very common heart rhythm problem, and the frequency is on the rise. It's estimated that 2.5 million Americans have atrial fibrillation. And not only is it a common heart rhythm problem, but there's increasingly things that can be done about it. Atrial fibrillation is an abnormal heart rhythm originating in the upper chambers of the heart, known as the atria. Normally, you have an electrical impulse that starts in the right atrium, it spreads through the atria, and then goes down to the ventricles, and once that's complete, you basically have a flat line until the next heartbeat starts. And then in atrial fibrillation, that metronome-like regular electrical activity is replaced by an erratic, rapid electrical, basically a storm. And that storm is transmitted to the ventricles in an irregular, uncontrolled way, and you get this irregular pulse as a result, the hallmark of atrial fibrillation. Atrial fibrillation, first off, can lead to symptoms, but even more importantly, it increases the risk of stroke. In fact, the risk of stroke is 5 times higher in patients with atrial fibrillation than without. When we look at atrial fibrillation treatment, we start with an assessment of the whole patient. We look at the risk of stroke, and in many people we end up prescribing anticoagulants. We also frequently prescribe medications to slow the irregular pulse that I mentioned earlier, and that may be enough to prevent symptoms, and that may be all we need to do. But in many people we have to try to restore the heart rhythm. We may do that with medications that stabilize the electrical system, but frequently we need to resort to procedures like ablations.